Yeah, welcome, um, early Keaters. Thanks for coming. I'm Davidicus Wong, family doctor in Burnaby, and thanks for joining me and Leona Cullen from the Burnaby Division of Family Practice for our Empowering Patients talk. So if you haven't been to one of our talks before, we're trying to provide on behalf of the Burnaby Division of Family Practice, which is the nonprofit whose members are the doctors that serve the patients of Burnaby. So that includes East Vancouver, parts of New West as well. But we come together to improve the well-being of everyone in our community, not only our shared patients, but also everyone, because there's a lot of people that don't have a family doctor. So this talk will be useful for all of us, all of us as adults, to know what tests we need at different ages. And actually really important if you don't have a family doctor. So you might be able to ask another doctor in the clinic, can you get these tests done if you're due for them? And also explaining what the principle of screening tests are. And the other important thing I'll be covering are important symptoms, because very few people have complete physicals anymore. It was long felt just a consensus that a routine physical on every child or every adult does not make any sense and does not necessarily improve outcomes for those individuals. Um, but we do complete physicals on specific conditions. With medical services plan, we have to justify why a complete physical is indicated or necessary. And that would be someone that has a systemic condition or a variety of symptoms where we need to do a whole body check. So it's based on the situation, the symptoms, and some conditions like diabetes that affect nearly every organ system, or congestive heart failure, or some types of rheumatic disease, does require kind of looking at all parts of the body and kind of doing a careful review of all of the patient's systems. So one part of a complete physical that people don't hear anymore because it's not a routine thing anymore is the review of systems. That's actually a list that a doctor will go through asking about how all the functioning is in different parts of the body, the nervous system, the skin, cardiovascular system, the respiratory system, general symptoms like energy, your sleep, and your weight. So a variety of symptoms to every organ of the body. And we kind of gather what things are found to be normal and what symptoms might require further investigation. So I'll give you a kind of a tour of the review of systems and the kind of symptoms that you should report to your doctor because they might indicate a significant condition. So if you lean towards being a hypochondriac, like many of us are, I hope I don't cause more alarm, but I think it still would be useful. And even hypochondriacs get sick sometime. I'd like to introduce you to Leona Cullen. So she's been a big foundation of our Empowering Patients program. So she does a lot of all the background work and organization to make our talks possible. And Leona is very active in the community and with the Burnaby Division and the Primary Care Network. So she'll update us on the latest things in Burnaby.
All right. Thank you, Dr. Wong, and thank you for joining us on this cold and rainy evening. So nice that you came out tonight. And there's actually another Leona in the audience today. So there's not many of us. So welcome, Leona. It's good to see another one. So as Dr. Wong said, I work with the Burnaby Division. I'm the operations manager, and I've been had the pleasure of working with Dr. Wong for more than 10 years with the Empowering Patients program and putting this information out into the universe for local Burnaby residents and beyond. So I'm going to be popping some resources into our chat. And so please click through, save the pages. There's lots of really great information out there. So the first one is pleased to announce that we've launched a brand new Burnaby Division of Family Practice website. We have a wonderful communications team that have brought us into the new millennium, and our website looks polished and wonderful. And so I'm just gonna put a link to that. Actually, I'll put a link to our staff and board page so you can see all the people working behind the scenes to support our Burnaby family doctors. Then there's obviously the Empowering Patients page, which includes upcoming talks, so our schedule through to April 2026, some downloadable patient resources, Dr. Wong's presentations, as well as some information sheets from each of the topics and past recordings of the talks that we've done. So I think many of you saw that this webinar is being recorded, and so I will be putting this up live tomorrow so you can click through, watch it again, share it with your friends and family. The other another link I'll post is our Burnaby PCN, or Primary Care Networks website, which Primary Care Networks is a collaboration between the Burnaby Division, the Fraser Health Authority, and many Burnaby community organizations. So basically, taking all the wonderful work that they do and putting it around, wrapping it around you, the patient. So if you live in Burnaby specifically, there's a lot of great resources available. So I'm going to pop a few links, including if you don't have a doctor, I'll put a link as to how you can find one. I'm going to put some information up, a link through to our urgent care centers here in Burnaby. There's two of them. So as we go into the holidays, and if something sort of happens and you can't get in to see a doctor, the urgent care centers are a great place to go. I'll share some information on that. Again, as we're in the holiday season, we have the community fridge program. And so I think there's four. I should have peeked. I think there's four community fridges here in Burnaby where people donate food, and then it can be picked up by people in need. So if you have some bits, take a look at what the criteria is, and perhaps you can contribute. Or if you're in need, please visit those. We do also, for the next few months, offer pop-up metabolic screening clinics. So if you don't have a family doctor, you live in Burnaby, you haven't had lab work done for a while, you haven't had your blood pressure checked for a while, maybe bookmark that page, because we'll be posting our upcoming pop-up clinics that'll be happening in the Burnaby area. So you can go get some service there. And last, on the PCN front, is the checkup. So that's our monthly newsletter. You can subscribe to it, and it's a source for the latest public health news, community events, and many resources. So that's it. You'll just see the chat going a bit crazy while Dr. Wong gets started. And again, thank you for joining us. At the end of our webinar, so after we go through questions and such with Dr. Wong, and I close down the webinar, there is an evaluation screen that'll pop up. So if you have a couple of minutes, please take the time to answer those questions. There's 8 this time. So if you wouldn't mind, it's super helpful. So, okay, back to you, Dr. Wong.
Great. Thanks, Leona. So let's get rolling. Just a reminder that you can find our webpage at divisionsbc.ca/Burnaby. As Leona mentioned, you'll hopefully find the video and a copy of the slides and a key points handout that you can refer to, including a little chart on screening tests, so you don't have to take notes, and all the information should be there. I always start with wondering why we're here, the big questions. Just a reminder that family doctors care about our patients, and we care about our community. And together, all of you and us are responsible for the whole community and our future. So we care about our patients and the community. So today I'll be talking about making sense of symptoms and screening tests. So I'll do a quick review of the 4 foundations of self-care, kind of a foundational approach to looking after ourselves and the purpose of our talks. I'll talk about that complete physical exam, because people are always wondering, I haven't had a complete physical ever, or I haven't had one for a while. Do I need one? So to answer those questions, and a review of important symptoms to watch out for, to bring to the attention of a healthcare provider, and the alarm symptoms. So these are like serious conditions that sometimes take precedence when you come to the doctor for lumps and bumps and renewal of prescriptions. And if you have these symptoms, they are important things to look after right away. So we like to know about them immediately, rather than adding on one more question at the end as you're at the end of your doctor's visit. So they're really important to pay attention to. And we'll go through the screening tests, what tests we need at different ages. So what is healthcare? If you ask a family doctor, we'll tell you it's not all the stuff in the hospital that you see on TV. It's the stuff we do in the community. But if you think about who provides most of your healthcare, it's not professional healthcare providers. It's you, of course. And if you get some help from family members, your caregivers and your support. So that's why we're here. That's why we have this Empowering Patients public education program. So it's our mission to give you the information you need so that you can live your healthiest life, that you can recognize when you need the help of a healthcare provider, and help us guide you to navigate the healthcare system because it is quite complicated, and it's great to have a family doctor of your own to be your advocate and get you to the resources and the help you need. And it's a lot about preventive and proactive care. So I really believe that real healthcare is what you're doing, self-care. And the one who provides most of your healthcare, 99% of it is yourself. The best predictor of our future health, those things that are within our control, are the habits we practice every day. And those four foundations of self-care include what you put into your body, what you eat, like a healthy, balanced diet, and trying not to put in things that are noxious or harmful, such as cigarette smoke or alcohol or recreational drugs. The second foundation of self-care is what you do, physical activity balanced by adequate rest and sleep. The third foundation of self-care, how you feel, emotional well-being. And finally, the fourth foundation is how we connect, healthy relationships. So these have been topics and future topics of our talks. And the rest of our talks really surround about specific disease conditions, navigating the healthcare system. Next month, I'll be talking about what everyone should know about medical ethics and how to advocate for yourself or advocate for your loved ones in the healthcare system. So to be an empowered patient, we need good self-care, but we also need unbiased health information. So I'm here to try to convey unbiased information. Of course, it's always biased by my opinion, but based on consensus and medical evidence. And unlike a lot of things we see on TV or on the internet or here on the radio, I'm not trying to sell you anything. I just want a healthier community, giving back to my hometown community as I grew up in Burnaby, went to school since kindergarten, elementary school, and high school at Burnaby North. So I just want to give back to a wonderful community as well. So we want to give you unbiased information to adopt healthier lifestyles, to manage health conditions, and to how to get the care you need from people like me, healthcare providers. Improving the communication between patients and doctors, and know how doctors think, and know how to be advocates for yourself. And we want to help you achieve your personal goals. There's no such thing as doctor's orders anymore, but doctors have to know what is important to you as an individual. So that complete physical. So the routine physical, that means a physical when there aren't any symptoms in a patient that is feeling well and apparently well and no risk factors is not covered by MSP. So there has to be, we have to justify it medically to have it covered. Of course, people can have private physicals, and there are some physicals that are not covered by MSP that some people have to pay for, like the driver's medical exam for people over 80. It's unfortunately not covered by BC Medical, although I wish it was because it's quite an expense when you're over 80. And most people over 80 are retired and don't have a big income. But that is not covered, as well as physicals for a job, employment, for travel. But some countries require a physical before traveling and a certificate that you're healthy. So we do complete physicals for prenatal care, just to make sure there aren't any other underlying conditions that we should know about that could be impacted by the pregnancy or that can affect the pregnancy as well. And certain chronic conditions such as diabetes, as I had mentioned, and heart disease, like heart failure and atherosclerotic heart disease related to chest pain or heart attacks, or other symptoms that suggest more of a systemic condition involving multiple systems of the body. And some examples that I had mentioned, not covered by MSP, are the driver's medical examinations, with an exception. There are driver's medical exams, and you could tell it's a blue stripe form that is covered by MSP, at least partially. And those are physical exams specific to certain conditions. So when you're applying for driver's license, you're required legally to disclose if you have any significant medical conditions, such as diabetes, or problems with your vision, or heart disease, or if you've had a heart attack. And when you do that, it gets flagged and then sent to the office of the superintendent of motor vehicles. And then they will often send you a form that you have to bring to your doctor to talk about the details of that condition that could affect driving. And we do specific examinations, not necessarily a head-to-toe examination for every condition, to make sure that condition is not a detriment to your ability to drive safely. So other physicals that are not covered by MSP include fitness to be in a sports cab or to play varsity athletics, industrial first aid examinations. They just want to make sure you're physically fit to do that, but that's not covered either. Or certification for scuba diving training, for the PADI certification, also not covered by MSP. So there's certain suggested rates for these private physicals by the doctors of BC. But what you would hear if you have a complete physical is what we call the review of systems. So it's going by circulatory or organ system with questions that may indicate underlying disease. So as I mentioned, if you're a hypochondriac, you don't have to leave, but hopefully I won't be stressing you. So let's go category by category, the questions that you might be asked if you were to have a complete physical, but things to consider yourself on an ongoing basis. So general symptoms might include, how has your energy changed? Has there been a change in the last year or so? And there are many causes for decreased energy. Some of us might attribute it to age, but a decrease in your overall energy can be due to depression. It could be due to an underactive thyroid gland, which is located here. Usually you cannot feel it, but when it becomes underactive, our energy levels drop because the thyroid hormone it produces keeps our heart beating fast, helps us metabolize. And we'll talk later about what happens when the thyroid is overactive. If you're not getting enough sleep and you have insomnia, of course, you're going to be tired during the day. If you have a certain breathing condition when you're sleeping, obstructive sleep apnea, where your airway closes a bit during the night and you have moments where you stop breathing for a number of seconds, that can lower your overall oxygen concentration in your blood and make you feel really tired when you wake up and also sleepy during the daytime as well. There's a variety of respiratory conditions like chronic lung disease or chronic bronchitis or interstitial lung disease that can also make you feel really fatigued as well, especially when you're exerting yourself doing physical activity. If your heart's not pumping as strong as it usually does, we call that congestive heart failure. That can cause exhaustion and fatigue. If your red blood cells are low, that's called anemia. And because red blood cells carry oxygen that's needed for energy in all of our cells, if those numbers are low, then you will be tired, especially with exertion as well. And there's a variety of medications that can make you feel sleepy or tired or drowsy. Certain conditions, like when the bone marrow is producing too many white blood cells, such as in leukemia or lymphoma, and other cancers, can cause a decrease in energy, along with other symptoms that we'll cover in a few moments. And so another part of a change in your energy is some people have an increase in their energy for no apparent reason. So there's a variety of things can cause that. It could be anxiety that gives you, well, a lot of nervous energy so that you can't stop thinking and moving around. And you might be physically agitated as well and unable to sleep and generally restless. A lot of adults and kids with attention deficit disorder and hyperactivity, a subset of ADHD, do feel really restless and moving around all the time. And it's those little boys or little girls that have that hyperactive type of attention deficit hyperactivity disorder that draw more attention by the teacher. It's the quieter ones that aren't hyperactive, but still distracted that don't always get picked up in elementary school. There's a psychiatric condition called mania, and that's where you have an elated sense of physical as well as mental energy and even euphoria, feeling really amazingly joyful, like you won the lottery. That can give people extra energy. And one of the symptoms of mania is having loads of energy, being able to get by in just a couple hours or no sleep at night and still have energy to clean up the whole house or do a huge project. So watch out for mood symptoms associated with increased energy. Most people don't complain to the doctor when they're feeling really good and have lots of energy. Of course, certain medications can cause agitation or increase energy, including the medications we use for attention deficit hyperactivity disorder, the stimulants. And an overactive thyroid gland can raise the thyroid hormone levels in your blood, cause your heart rate to beat faster, make you feel hotter and warmer, make you lose weight, and increase your overall energy, and possibly cause insomnia as well. And there's a variety of other hormonal conditions that can affect your energy level. Another general question we'll ask is, have you gained or lost a significant amount of weight, like more than 5 pounds? Of course, this could be due to holidays. So I think my average patient that takes a cruise or spends a week in a resort in Mexico will probably gain at least 5 pounds. So it can be due to the calories you consume by eating a lot or eating more than we did before, or a decrease in our activity. If we've had an injury and we can't go for our regular walks and do the usual physical things, we're not burning as many calories. So that can cause us to gain weight. But conditions such as diabetes can cause us to gain weight and increase abdominal body fat. And congestive heart failure can make us gain weight by retaining fluid. So someone where their heart's not pumping strong enough, as in congestive heart failure, um, we ask our patients to weigh themselves every day. So that if they gain 5 pounds in one day, it wasn't from obviously from overeating. That could just be from fluid retention, and their ankles may be swollen, and they might feel short of breath at nighttime. And if they gain more than 10 pounds in a week, and they haven't been on a big cruise ship, then that could also be from fluid retention. And we want to assess those individuals and make sure we don't need to take off that extra fluid with medication. If our kidneys are not functioning and helping us eliminate our fluids, then that can cause swelling of the ankles and increased weight. And there's a variety of medications that could also cause weight gain. There actually is so many that could do that. And an underactive thyroid, where that reduces your metabolism, can contribute as well. And weight loss could also be due to anorexia, an eating disorder, where a person can restrict their calories and skip meals. That might include an impaired body image, so they don't feel that they're underweight, but other people around them may notice. So an inadequate diet, depression, if we lose our appetite with a drop in our mood, extreme stress or insomnia can make us burn more calories, excessive exercise, or a condition like diarrhea where we're not absorbing our nutrients. And if we had a parasite in the intestine, that could be a cause for weight loss. And a variety of drugs can affect the appetite or change your metabolism. Like too much of a thyroid hormone that's taken by someone with an underactive thyroid could push them into overactive thyroid and make them lose more weight. And there's a variety of medications, some actually prescribed for people that feel that they are unhealthy in their weight and want to lose weight, such as Ozempic, um, and a variety of other medications that increase metabolism. Smoking can also reduce appetite due to the nicotine. I don't recommend that if you want to do that for weight loss because of the toxic effects of cigarette smoke. But that's one of the reasons a lot of young women or teenage girls will start smoking is to control their appetite to stay slim. Cancers can also have a high metabolic rate and consume more calories and cause weight loss. That's why when there's, I think, unexplained weight loss, we definitely want to see an individual patient and kind of work through all the possibilities and do the workup to make sure there's no underlying cancers. And as I mentioned, an overactive thyroid gland will increase your metabolism, and other hormonal conditions can cause weight loss too. The next general symptom is an increase in hunger and thirst. So these could be symptoms of high blood sugars or diabetes. The next question is, how is your sleep? So sleep could be disturbed by an overactive thyroid, as I mentioned, by anxiety, by mood disorders, either depression or mania as well, by pain. So a lot of people with severe pain are not able to sleep as well. You might be woken up frequently because you have to go to the washroom due to problems with your bladder, like an overactive bladder, a bladder infection, or an enlarged prostate. And if you're having problems with your breathing, such as with congestive heart failure, when lying down, fluid could back up into the lungs and making you feel you need to sit up or stand up to breathe better. Shift work causes problems in people adjusting to the right bedtime, be able to fall asleep quickly and get a good long sleep. And then, of course, pregnancy, and then the result of pregnancy, children disturb your sleep as well. So let's start going through the systems, and we'll start with the neurological system, including the spinal cord, the peripheral nerves, and the brain. So a common question we'll ask is, are you having headaches? Because there's a big variety of headaches, and we ask specific questions to distinguish between migraine headaches, which are severe and throbbing and longer lasting, now lasting many hours. Tension headaches, often related to stress or increased muscle tension from other causes, and sinus headaches that can result in a head cold that affects the sinuses in the frontal, paranasal, facial areas. Some headaches are more worrisome, like escalating headaches that are actually getting worse with progressive drowsiness. These might indicate increased pressure in the brain, like what could happen with a stroke or a head injury or a tumor. So these are a very serious variety of headaches that require prompt medical attention. And if you have anyone or experience any of these symptoms, escalating, worsening headaches and progressive drowsiness, that requires attendance at the emergency. And any progressive symptoms with any changes in your behavior or function require prompt medical attention, because these could be symptoms of a stroke, for example. The next neurological symptom would be, do you have tremors, like shaking of fingers, hands, or other parts of the body? So tremors are involuntary movements that can be just common and everyday and not serious, like what we call the familial resting tremor. That is very common. You could even see them in some children, and usually there's some family history. But that's quite different from Parkinson's and other movement disorders, which have very distinctive type of tremors associated with other neurological symptoms. For example, a person with Parkinson's symptoms has what we call a typical pill rolling tremor. So it's not as fine as the fine tremor, but it's more of a rhythmic tremor. And there's a certain type of change resistance when we're testing muscles, what we call cogwheeling. It's not as smooth. So when we're resisting someone's arm, then it seems to be bouncing around a bit. And often in Parkinson's, the handwriting may become smaller than usual. Uh, Facial expressions seem to flatten out. So even if they're happy, the individual with Parkinson's may just have a flat face as if they're kind of bored and not be able to express uh, facially how they're feeling. And Parkinson's typically, as it progresses, um, people will have difficulties initiating motor movements, like great difficulty getting out of the chair, not due to any pain in the back or the legs, but the signal is not going to the legs and the muscles to get moving. So difficulty is starting those movements, like, and then coordinating a normal walk or gait. The next neurological question would be, do you have dizziness? And there's a variety of dizziness as well. So simply lightheadedness is kind of like the head rush you might feel if you stand up really quickly. So this may not necessarily be a neurological cause. It could be due to a lower blood pressure. You can have lightheadedness with low blood sugar, or if you're anemic with a low red blood cell count, you can also feel lightheaded. Vertigo is an exaggerated sense of motion. So usually what we mean by vertigo is that feeling when you've been on a merry-go-round and then jumping off, that sense that you're kind of spinning and moving, or things are moving around you faster than they really are. So this can be a disorder of the ear, within the ear. So if you see that little blue area in the bottom left-hand corner, so that's in the inner ear. The outer ear is the part where you accumulate all the wax and where you get water. The middle ear is where the eardrum and the three tiny bones in the ear, that's connected to the eustachian tube that goes to your nose. So it's that middle ear that gets congested when you have a head cold and when you're going up and down elevations, such as in an airplane launching or landing, or when you're climbing or driving up into the mountains or coming down. That's the middle ear that's equalizing on both sides of the eardrum. The inner ear is where you have the hearing organ, the cochlea, and the semicircular canals. The semicircular canals are oriented in 3 dimensions, and they help give us a sense of balance or tell us where we are in terms of movement. So labyrinthitis, inflammation of those semicircular canals, and that can cause vertigo. Sometimes if we've been doing an activity in a different posture and unusual movement, we can move the particles that are within these semicircular canals. And those particles in the wrong position could cause recurrent vertigo. And there's some head exercises, positioning exercises we could do, or with the guidance of an expert physio, a vestibular physiotherapist, that can correct that type of imbalance. But vertigo or a loss of sense of balance could also be due to problems in that area in the back of your brain called the cerebellum. So cerebellar conditions can affect our coordination and sense of balance. So yeah, here's like 4 general types of dizziness. One is that vertigo, that loss, that sense of motion or spinning that's exaggerated. Disequilibrium is just feeling off balance or kind of feeling unsteady and wobbly, similar to vertigo. And lightheadedness is just feeling kind of woozy or disconnected in your head. And pre-syncope means you're feeling you're about to lose consciousness, like you're about to pass out. And if you do feel that way, don't try to hold yourself up, and don't try to let other people hold you up. You actually want to sit down and get your feet up or lie down if it's safe to do so. Because what's happening in syncope and pre-syncope is blood may be pooling in the legs due to a variety of reasons, like a hot day or edema in the legs, or a regular heart rhythm that can cause the pressure to drop. So if you stay standing up, then you'll get less blood to your brain and you could pass out. But by lying down and getting your feet up, then blood returns to the brain and you would usually feel better. So persistent vertigo, or vertigo that's associated with other neurological symptoms, like severe headaches or severe nausea, requires timely medical attention. So our next neurological symptom would be, do you have any numbness or altered sensation? This could be due to a variety of conditions that are affecting specific nerves. For example, if in the morning you're getting tingling or numbness in these 3 fingers, the thumb, the index, and middle finger on the palm side, starting at the wrist, that's the distribution of the median nerve that passes through the carpal tunnel. So if we've been using our wrists a lot, swelling of those tendons and inflammation, or even just pregnancy or underactive thyroid could cause swelling that pushes on the median nerve and causes tingling and numbness in these 3 fingers. So that's the example of carpal tunnel syndrome. Some people have the numbness on the little ring finger, little finger side going up their arm. And sometimes that's due to entrapment of the ulnar nerve at the funny bone. So a lot of us, if we're leaning on that when we're driving or when we're at our desks or computers, or sleeping on it with a bent arm at nighttime, could be compressing the ulnar nerve, causing tingling and numbness on this side of the head. And there are nerve conduction tests we could do to confirm if you have significant compression of the ulnar or the median nerves in the hand, at the wrist or in the elbow. Another example of a nerve that could be pinched would be the sciatic nerve that runs from the lumbar and sacral spine down into your foot. So if there's a disc herniation or arthritic changes that compress over that sciatic nerve, that can cause pain, numbness, and tingling or weakness in that distribution down into the foot. And of course, something going on with the spinal cord, like a tumor or a stroke or multiple sclerosis, can also cause loss of sensations as well. So the doctor will ask even more detailed questions to try to find out what's causing these altered sensations. Have you had any memory problems? So causes can be normal aging, where we have a little bit of short-term forgetfulness, which is sometimes a slippery slope and hard to distinguish from early Alzheimer's dementia. So if you have concerns about your memory or your loved ones are concerned about your memory, it is worthwhile speaking to your doctor. And so we can do specific memory tests just to see what your baseline is right now. And we can ensure that there's no progressive decline. And we do see some deficits. We do further investigations to find out what the cause is, and therefore can assist in management and improvement of your memory. Memory could be affected by a severe anxiety, of course, when we're distracted and have trouble focusing on what we're doing and what we're supposed to remember in the task at hand, as can extreme stress. Depression can cause what we call pseudo-dementia. So not a real dementia, but feeling not as sharp just because our low mood could be affecting our quality of our thinking, our cognition. And people with attention deficit disorder might forget things because they haven't been able to pay attention. They were actually focused on something else when the teacher was providing that lesson and being distracted when they're trying to focus on their studies. And the dementia, as I mentioned, and other conditions that can affect the brain can affect the memory as well. So if you do have memory concerns, it's not a waste of time to speak to your doctor, and we can sort through possible causes, but definitely assess how your cognitive function is right now. Another neurological symptom is a seizure, which is a temporary loss of consciousness, usually associated with involuntary movement. So the classic one is what we call the grand mal seizure, where the person becomes unconscious and drops and is shaking all over. There are other seizures where there's just loss of consciousness in small children. An absent seizure is a child could be talking in mid-sentence and then blank out, and then return to talking and not have any recollection of what happened. But there hadn't been any shaking or rhythmic movements or involuntary movements. A stroke is the sudden appearance of neurological symptoms such as weakness, numbness, loss of speech, loss of vision, severe imbalance, and behavioral changes. So a stroke means uh, a problem with the circulation in the brain, where a portion of the brain is not getting its blood supply. And it could be a blood clot type stroke. We call that thrombus meaning a clot. Embolic means a clot that launches somewhere else on the system, like from a deep vein in the leg, getting embolized or shot off into the lungs, causing a pulmonary embolism. But a blood clot going up into the brain would be a stroke, or clogging the carotid arteries and vertebral arteries. So if you're losing your field of vision on one side, that is a neurological emergency and you would call 911. Think of stroke symptoms like symptoms of a brain attack. So when you're having chest pain and might have a heart attack, you don't drive to the hospital or wait overnight to see if it gets better. You call 911 so that if it's a heart attack, then you get attended to right away. And likewise with a stroke, if you have some sudden changes in speech, sensation, or weakness, or loss of function, that should prompt us to call 911 as well, because some strokes are reversible, and the sooner they're recognized, the better. So we'll move on to the head and neck symptoms. Do you have any problems hearing? So hearing could be age-related. We call that presbycusis. And of course, the older we get, the more likely we'll lose more hearing. And eventually, many of us will get hearing aids. And that's not uncommon and not necessarily due to noise exposure. It reminds me of a couple that would come in frequently. Usually, the wife would come in and tell me what to check out and Bob. And so one year, Ellen came and for her general visit and asked me to check out Tom's hearing because he doesn't seem to be using his hearing aids don't seem to be working as well when she's trying to tell him some important things. And when I saw Tom the next day, he mentioned that my hearing aids work really good. I just turn them off when I want peace and quiet. So it's kind of funny how much hearing people want and don't want. Noise-induced hearing loss, we can have hearing loss at a younger age. So early on in life, often when you're working in a profession where you're around lots of loud noise, like police officers with guns, construction workers, it's so important to have hearing protection. And often musicians, professional musicians and recreational musicians, because doing concerts, the music's turned way up for the audience, and that can expose people to hearing damage from noise exposure. And of course, a stroke can cause a sudden total loss of hearing in one ear. Tumors can cause the same thing that involve the cochlear organ in the inner ear. And things that cause subtle, not complete hearing loss would be simply a foreign body in the ear, and the most common one is earwax. So it's impossible to look in your ear yourself. There's no app for that yet. So usually you do have to see a healthcare provider like myself to check for earwax and then help you flush or remove it. And another common cause for temporary hearing loss is clogged eustachian tubes. As I mentioned earlier, the eustachian tube is that tube in the back of your nose and throat that goes up into the middle ear, right behind the eardrum. We need that space to be clear and not all clogged up with mucus like from a head cold in order for your eardrum to vibrate the when sound strikes it. So it's those vibrations that are transmitted to the three little bones in the middle ear, malleus, incus, and stapes, and then they pass that vibration on to the cochlea, the hearing organ in the inner ear. Tinnitus is the sensation of ringing in the ears. It can be high or low pitched, but generally high pitched, and often that's related to hearing loss. It can also be due to a condition called many ears disease, where there's both the sensation of vertigo as well as the tinnitus or ringing in the ears. And you sometimes get some ringing in the ears with just congestion of that eustachian tube in the middle ear. So do you have difficulty breathing through your nose? So that could be due to allergies. Of course, there may be other symptoms of allergies like sneezing, a drippy, watery discharge, sometimes itchy, watery eyes at the same time, or the deviation of the nasal septum. So if you've had a nose injury, that can sometimes cause the nasal septum, instead of being in the midline, to be twisted to one side or lean towards one side, so one side would be more blocked than the other. And we've also removed foreign bodies from little kids' noses, but there could also be tumors, especially in Asian people. Chinese people are at higher risk for nasopharyngeal carcinoma, which could be marked by obstruction of the nasal passage plus frequent bleeding. So it's worthwhile seeing a doctor if you're having difficulty breathing through one side of the nose, or if there's been a chronic nosebleed or recurrent nosebleed. And that question, have you been bothered by nosebleeds? Usually it is minor, more common in kids, but it could also be related to a bleeding disorder, like insufficient platelets, so that you're not producing clots, or that nasopharyngeal cancer. So seeing the doctor to check it out is worthwhile if it's been recurrent or prolonged. Do you have double vision? This could be caused by abnormalities in the eye muscles, but it could also be due to tumors. For example, a tumor that can affect the optic nerves as well, or the muscles of the eyes, or the cranial nerves. A sudden loss of vision, of course, is an emergency. So that could be due to the detachment of the lining in the back of the eye, the retina. So a retinal detachment is when there's a separation from the back of the eye, and the retina is really essential for your sharp vision. So that's actually the screen that everything you look at is projected upon, and that's connected directly to the optic nerve. So a stroke can cause a sudden loss of the field of vision, usually in both eyes. But a retinal detachment can be like a shadow covering portion of your vision, like a curtain from any direction, often associated with flashes in the periphery that can occur whether or not you're moving your eyes. And a retinal detachment sometimes is marked by a shower of new floaters. So I had a retinal tear, a traumatic retinal tear, but not a detachment from the swimming pool. So as I was coming in at Island Daily Pool to do a flip turn, there was just a man that was just standing at the end and only wasn't moving. And then only after I had done my kick turn to T launch out and do a side kick with his wide breaststroke and then struck the side of my head. And then it felt like a concussion, but within hours I started to see flashes in the peripheral of my vision. And then tried to get into the emergency to get assessed, but ended up seeing my regular ophthalmologist who saw me right away, diagnosed the tears, and got me in to get a laser procedure immediately. So if you have symptoms of a retinal detachment, it does require immediate attention by an optometrist. It should be seen the same day. If you have an optometrist that can see you, or your regular ophthalmologist is able to see you, or the emergency, if you aren't able to contact them as well, we just need one of those experts to do a careful assessment and then treat it or refer to a retinal specialist as indicated. So don't wait if you have a sudden shower of floating things in your eyes and flashes or a loss of any part of the field of your vision. And the musculoskeletal system. That's just a reminder of the time I had 9 rib fractures involving 7 ribs from the flying trapeze. Not from falling from the trapeze, but landing on the bar the wrong way, obviously over a whole bunch of ribs. Have you had swelling or stiffness in any joints? So these could be the symptoms of an inflammatory condition, inflammatory arthritis, such as rheumatoid arthritis that I had as a kid. And those are marked by visible, painful swelling of a joint. Um, Usually these joints, the proximal interphalangeal joints or the metacarpal phalangeal joints, not so much the distal interphalangeal joints near the tips. So often that swelling is worse in the morning for at least an hour in the morning. It's kind of typical of an inflammatory arthritis. Some people with the skin condition psoriasis don't know that there's a type of arthritis very similar to rheumatoid arthritis and treated in similar ways that can affect the joints the same way. So people with psoriasis are at increased risk for also having an inflammatory arthritis. And another kind of inflammatory arthritis is gout. So gout typically for most people involves the big toe, where the big toe meets the foot. We call it the metatarsal phalangeal joint. So people with high uric acid, which is often inherited but worsened by certain dietary things, uric acid can crystallize in a joint, and that joint would be hot and red to touch, almost like you were having an infection, and extremely painful to move that joint at all. And it's important that gets looked after and treated with the appropriate anti-inflammatory medication. And then to prevent it, we look at the levels of uric acid and how to bring that down. Have you had locking or decreased range of motion in any joint? Now, this could be due to degenerative or osteoarthritis, the usual wear and tear where the cartilage wears down, or due to an injury of a joint as well, like fluid in a joint. On to the cardiovascular system. Have you had chest or neck, throat, or arm pain or pressure? Because these could be symptoms of angina. So not always felt in the chest, but can involve the neck, the throat, or the arm. And it could be left or right arm, but typically we say the left arm. So angina is when there's decreased blood flow to the actual muscle of the heart, not the blood flowing through it, but the actual muscle that contracts with each heartbeat. So usually the pain or the pressure will be felt when someone is exerting themselves, when the heart's pumping faster, working harder. So we might sometimes ask, do you get the chest pain when you're stressed? It's not because we think it's all in your head, it's just due to stress. Because anxiety and stress also makes the heart beat faster and work harder. So anything that makes the heart beat faster, if that's causing the symptoms of angina, chest pain, or pressure. And if it's relieved by rest, that's suspicious for a problem with the circulation to the blood vessels that supply the heart. And we might ask the patient if he or she has palpitations. So this is the sensation of your heart pounding, beating irregularly, like skipping beats, and it might indicate a rhythm disorder. Though a lot of people do have rhythm disorders like atrial fibrillation, but they don't even have a sense of palpitation. So everyone's a bit different on what they might notice in their own body. Do you have pain in your calves when you're walking? So pain in your calves that's relieved by rest might indicate poor circulation to the arteries to your legs. We call that symptom claudication. So someone with narrowing of the arteries or blocking of the arteries that run down into the thigh and into the calf and into the foot will often feel an achiness and pain in their calves when they're walking a certain distance or walking uphill because those muscles are demanding more blood for circulation. And when they're not getting it, it can cause pain that's similar, analogous to the angina of chest pain. Do you have painful swelling in one leg? This could be due to a blood clot. We call them DVTs or deep vein thromboses. So a blood clot in the leg that might break off and cause that life-threatening embolus or clot in the lung that can cause an arrest or sudden death. Do you have shortness of breath with exertion, like when you're exercising? And it doesn't necessarily mean walking or walking uphill. It could be going up the stairs, doing your laundry, doing physical things. This could be a symptom of heart disease involving the circulation of the heart or heart failure, the pumping action of the heart. Shortness of breath with exertion could also be due to anemia, because if the blood cells are low, then you're not getting enough oxygen to all your cells. And of course, asthma is reversible bronchoconstriction. So the bronchioles in the lungs are constricted. So you'll hear wheezing and feel short of breath, especially with exertion. Chronic lung disease means emphysema or chronic bronchitis. Sometimes that comes even in non-smokers, but more common in people that have smoked. Sometimes people are short of breath just because they need to work out a little bit more, but we need to rule out the more serious respiratory, blood, or cardiac conditions. The classic symptoms of congestive heart failure, where the heart's not pumping as strong as it should, would be shortness of breath when you're exerting yourself, shortness of breath when you're lying down, because blood will pool back up into the lungs. Swelling of the feet and legs, what we call edema, and we call it pitting edema, because with the swelling in the ankles and feet, when there's fluid retention, when you press on it, you'll leave an indentation or a little pit. And weight gain of 5 pounds in one day is suspicious for fluid retention. Now on to the respiratory system. Do you have difficulty breathing? This could be due to asthma, chronic lung disease, as we mentioned, anemia, heart disease, heart failure, lung cancer, respiratory infection, of course, including pneumonia, RSV, and COVID-19. Do you wheeze? So wheezing is a musical sound we would hear when you're breathing out, assuming you're not playing a clarinet or a trumpet at the same time. This may be a sign of asthma or bronchitis, but it could be due to anything that partially obstructs your airway. Have you been coughing? Nowadays, lots of people are coughing. A cough is caused by anything that's irritating the airway from the back of your throat all the way down your trachea to your lungs. So it can be from simple colds. It could be from allergies with a postnasal drip. It could be from bronchitis, infection, inflammation of the lungs. Asthma, as we mentioned with bronchoconstriction. It could be from acid reflux from the stomach and the esophagus, can tickle or irritate the throat and cause a cough. And of course, could be COVID, pneumonia, RSV, respiratory tract tumors or cancers, and certain drugs such as uh, ACE inhibitors like Ramipril. So about 10 or 15% of people that start that, we always warn them. There's a proportion of people that will get a reflex cough when they take the medication. Doesn't mean anything's wrong with your lungs, but it usually will not go away as long as we're taking the medication. So usually that incessant cough that bothers that individual's quality of life or the quality of life of their spouse would be a good reason to switch to another medication that can accomplish the same thing. Have you coughed up blood? So of course, if you've had a nosebleed and then cough that up, we know what the cause is. You could also cough up blood if you've been vomiting a lot and broken some blood vessels. But it could also be due to cancers in the nose or in the back of the pharynx, in the back of the throat or nose, or lung cancer can also cause some blood in the sputum. So it's important based on the individual's age, their smoking history, and other symptoms, we can work through what the causes are. But if you have coughed up blood, that's important to talk to your doctor and to get checked out. So on to the plumbing, the urinary system. Do you have difficulty with urination? We're talking about the flow, the frequency, the control of the bladder, or any pain with urination. So a decreased flow may be due to narrowing of the urethra. So that's the tube that connects the bladder to the outside. So slightly different structures in men and women. But narrowing of the urethra through scars or after menopause from lack of estrogen can make the flow decrease, but also predispose to bladder infections as well. And of course, the prostate, which sits at the neck of the bladder, through which the urethra passes, if your prostate is enlarged, then that can also block the flow of urine through the urethra. And of course, a tumor within the urethra or the bladder can also affect the flow. The typical symptoms of a bladder infection are the urge to urinate more frequently than usual, often burning either in the bladder or in the urethra when you're urinating. So they're very similar to the symptoms of urethritis, which is usually a sexually transmitted condition. So depending on your age and habits and partners, it's important to get treated and investigated for this condition. So we wouldn't simply do just a urine dipstick if we suspect it could be an STI, like urethritis. We would also get special tests to check for chlamydia and gonorrhea, also in the urine. Incontinence means the loss of control, and in terms of urinary incontinence, it's the loss of bladder control. So just a reminder to look before you flush. Uh, that was just my joke that we used to think that Kung Fu was invented as a way of getting out of a Chinese restaurant washroom when they don't have paper towels. So blood in the urine, possible causes include bladder infections, kidney stones, or cancers of either the kidney or the bladder. So it's not a symptom that should be ignored and more serious as we get older. And of course, look before you sit down. Yeah, which one is right? Toilet seat up, toilet seat down. So it depends on your household. In our office, we always want that toilet seat down because that's the most functional that way. And again, this is my office toilet seat. So we actually have sometimes found it diagonally, which is not a compromise, but really dangerous for everyone. In terms of the genital symptoms to be asked, have you had pelvic pain? So ovarian cysts or tumors, endometriosis, where the lining of the uterus, the endometrium, actually has moved elsewhere, like outside of the uterus, can be a cause for pelvic pain. Uh, Uterine fibroids are benign growths that are within the uterus or the walls of the uterus. And although they're benign, they can cause a lot of pain with periods. And if they're large enough, pain with its pressure on other organs in the body. Of course, pregnancy can be a cause for pressure and pain and vaginal infections and STIs. So not something to be ignored. Um, it's important for women at menopause or after the age of menopause that pelvic pain or vaginal pain and pain with intercourse can be caused by the decrease in the estrogen effect on the vaginal tissue. So if you do have pelvic pain, a lot of people suffer silently with this and don't share that with their physician. But there's lots we can do to improve your quality of life. So if something is really affecting your quality of life, please share that with your physician. Are periods irregular, heavy, or painful? This could be due to hormonal conditions, due to, again, the benign growths or fibroids in the uterus, or endometriosis. And the cessation of periods might be due to pregnancy, to menopause, to breastfeeding, from anorexia, where a young woman loses so much weight that she doesn't have enough body fat to support her estrogen, and other hormonal conditions. And have you had abnormal vaginal bleeding or spotting? So obviously this could be due to hormones, but it could also be due to cervical cancers that have grown unchecked, or endometrial cancer, particularly if there's bleeding after the menopause. It's important that we do an ultrasound and endometrial biopsies to rule out cancer. Do you have any growth, or do you have any groin or genital sores, swelling, or growths? So we commonly can feel the lymph nodes, so you should be able to feel the lymph nodes in the groin. But if they seem to have enlarged, um, they need to be checked out by your doctor. If they seem to be tender, they need to be checked. We can develop hernias in the groin area called inguinal hernias, and that should be treated if it's causing any pain. But if you're not sure, it's always best to see your doctor. Cancers can cause swelling. Infected sweat glands or sebaceous cysts are the more common cause of tender swelling that we can treat with antibiotics or in hot compresses. Genital warts are common growth, as are monkeypox in those at risk. And other sexually transmitted infections can cause lesions or growths in the genital area. So most people would probably see a doctor if they weren't sure what they had, but if there's any doubt, do see a physician to get an appropriate diagnosis and treatment. So on to the bowels, the gastrointestinal symptoms. Do you have difficulty swallowing? So food getting stuck in your throat might indicate narrowing of the esophagus. So as you recall, when you swallow, food moves from the mouth to the esophagus, and from the esophagus to the stomach, and the stomach to the small intestine, to the large intestine, and then the rectum. So when food gets stuck in a narrowed esophagus, there could also be something else like a growth obstructing the passage of food. So if you have these symptoms, do see your physician. We would send you for further investigations, most likely including an upper GI endoscopy, esophageal gastroduodenoscopy. So that's where a gastroenterologist or surgeon, as a day procedure, will be able to look down the throat and esophagus and into the stomach to rule out any cause for obstruction. Do you have heartburn? So heartburn is usually a burning sensation in the throat or deep in the chest. And it could be caused by the fluids of the stomach just refluxing up with something called a hiatus hernia, where this part of the stomach, instead of just lying in the abdomen below the diaphragm, part of it can loop above the diaphragm and cause more reflux of any fluid from the stomach and food, sometimes acid coming up into the chest. Excessive alcohol can also cause inflammation of the esophagus. And have you been vomiting? So frequent and recurrent vomiting may be a symptom of bulimia, another eating disorder, an infection, a blood disorder, gallstones, or other intra-abdominal conditions. Nausea itself is a common symptom of pregnancy and also of migraine headaches, which have not too much to do with the gastrointestinal tract. So, to a potential employer, who you know is as important as what you know. That's what my Uncle Jim used to tell me. To a doctor, what you vomit is as important as if you vomit. So we want to know what's coming up. So if you're vomiting blood, it could be from a bleeding nose, if you've had a recent bleeding nose, so we look for evidence for that. It could be from a broken blood vessel in the throat. If you've been coughing or vomiting a lot, you might break a blood vessel. But it could also be from a bleeding ulcer. And people, especially people who have been drinking excessively, they can have dilated veins around the esophagus, what we call those esophageal varices, and they can rupture and cause a life-threatening upper GI bleed where you're vomiting blood as well. So generally, blood from a bleeding ulcer looks like coffee grains when you throw it up. So that's what we call the classic sign of a bleeding ulcer, and that is an emergency because you can have a life-threatening bleed from a stomach ulcer. Of course, if you just ate coffee grounds and threw it up, then we're not so panicky. And have you had an increase in gas? And this is, everyone has gas, just a reminder. Even the Queen has gas. And this was from a visit long ago to London. So we're really privileged to go to the Wax Museum. So other gastrointestinal symptoms, an increase in gas may be due to changes in your diet and not necessarily bad changes, like increasing fiber is not too bad for you. But fiber is what we don't absorb. So it passes right through and gives us nice firm stools, but could also contribute to gas. Some people are sensitive to lactose, which is the sugar in cow's milk. So usually we develop that into adulthood when we're not drinking as much milk. So that can cause more gas or diarrhea. If we're eating more fatty food, that can also produce more gas. And of course, if you're constipated, then the stools are sitting in the bowel and have more chance to ferment and produce more gas. But it could also be due to a bowel obstruction. So something causing a narrowing of the intestine. And in that case, there's certain signs that we can see in the office or in the emergency that if someone has a bowel obstruction. So if there's severe abdominal pain plus an increase in gas and no bowel movements, that could be a bowel obstruction requiring emergency care. Do you have a change in your bowel movements, either a change in the appearance of the stools or in the frequency of the stools? So if things get pretty slow at the holiday dinner tables, and you could always shock yourself by asking people around the table how often they have bowel movements. You'll shock each other, not even describing the poops. But it's quite normal for some people to have 3 regular bowel movements every day. And they've been doing that since they were children. And there's some people where their normal is 3 bowel movements per week. And that will shock the 3 bowel movement a day person because they think that sounds like severe constipation. How can you go a whole day or two without a bowel movement? And the other person will think that the 3 times a day person, that sounds almost like diarrhea. You must be spending all your time in the washroom. So that's the range of normal. But the key is a change from your normal pattern. Has there been a change in the caliber of your stool? So we're not talking about rating it from a scale of 1 to 10, like Dance with the Stars or the Olympics. We're talking about the size or the diameter of the stools. So pencil thin or flattened stools might indicate something in the abdomen compressing the colon. And that could be from a tumor in the colon, like a colon cancer. It could be some other mass like a fibroid or a variant tumor that's pushing on the outside of the colon. So definitely if you have persistent changes all the time or progressive changes with always pencil thin or flat stools, do see your doctor so we can investigate and see if you need a colonoscopy. Has there been a change in the frequency of your bowel movement? So constipation, often associated with straining and harder stools, and diarrhea, where the stools are loose or watery, with or without blood. And has there been blood in your stools? So this could be caused by hemorrhoids, which would be a fairly innocent cause, but you could still lose a lot of blood and become anemic from heavily bleeding hemorrhoids. A fissure is just a tear in just the rectal lining or mucosa, and those are excruciatingly painful, like a razor blade when you're having a bowel movement. So regular hemorrhoids are not that painful, and we treat that quite differently from hemorrhoids. There's certain ointments and creams that can relieve the pain of a fissure. Sometimes it could just be a little abrasion from a harder stool, which would heal very quickly. But it could also be due to a polyp in the rectum or colon, or and polyps can develop or turn into cancers as well. So melena, if you do a Google search for melena right now, it won't be the medical term you see initially. So the first page will be a whole bunch of young European women. The second page will actually show you what doctors think about when they hear the name Melina. That's why most doctors would not name their beautiful daughter Melina, because it means black tarry stool. And the black tarry stool is usually due to digested blood. So if you're having a bleeding ulcer, once that blood is digested, it usually appears like that. And we call that melena. And it's neither male nor female. Now, this is an important part. I actually have a poster in each of my exam rooms called alarm symptoms. So these are symptoms that may indicate serious conditions that require immediate medical attention. So if you have any of these, this takes priority. We need to deal with this right away. Even if they've brought a list of 5 different problems, the alarm symptoms take precedent. We might have to put off the other ones for a little bit. So one is pain that is unexplained, severe, colicky, electrical, or persistent, because, and that includes chest pain, especially if it is squeezing or associated with sweating, nausea, spreading to the neck or to the arm, because that could be a cardiac emergency. Or bone pain, especially if it is unremitting and disturbing sleep, because that could be a symptom of not just a fracture, but a bone tumor. The second group of alarm symptoms are loss of function, so an unexplained change in your speech, your memory, your emotions, your ability to swallow, with bowel movements, with urination, with your heart rhythm, with your vision or hearing, balance, coordination, sensation or muscle function, then we want you to go to emergency. It requires immediate emergency care most of the time because it could be a stroke, for example. And some constitutional alarm symptoms include unexplained sudden or progressive weight changes, usually a loss in weight, significant change in your energy, appetite, body temperature, thirst, leg swelling, and exercise tolerance. So these are priority symptoms. They don't require emergency, but they require your doctor's attention. And if you have any growths that are new or growing that are felt in the skin, the mouth, and within a muscle, in the breast, in the scrotum, in the lymph nodes felt around the neck and under the arms, or skin changes, including ugly looking moles or persistent scabs or sores that aren't healing, bring that to our attention because they could be potentially cancerous. So I'll show you some examples of atypical moles or moles that have higher risk for being skin cancer, a particular type of skin cancer called melanoma. So a mole that is asymmetric. So if you drew a line in the middle of the mole, it should be like a mirror image. So it should be like perfectly round and symmetrical. So if there's asymmetry, that's suspicious. B, we look at the border. So the border looks really jagged or uneven. That's suspicious. If the color is uneven or the color of the mole has changed, that's suspicious. And if the diameter is over 5 millimeters, which is the end of a pencil eraser, or if it has been expanding or getting bigger. So if you're seeing any of these, A, B, C, or D, bring it to your doctor's attention. It doesn't mean that it's melanoma or a cancer, because there's other skin lesions that might have these features but are totally benign. An example is the seborrheic keratosis. So I see 4 or 5 patients every week that want me to see this ugly mole that's changing. And typically, often it is not a mole, but a seborrheic keratosis. These almost look like turtles, but they usually start off looking at like moles, but they're slightly raised off the surface. They often can catch and bleed and peel on things. But if you have these and you're not sure and they haven't been looked at by a physician, it's important to check it out to make sure that's what they are. So these are benign, these are not. The next alarm symptom is bleeding in the urine, as we mentioned, in the sputum, like coughing it up, in your stools, or vomiting blood. Or if you're getting abnormal bruising, because this might indicate a bleeding disorder as well. So let's go on to the screening tests. So it's important to know that screening tests are done when you don't have any symptoms and you don't have the family history. So screening tests are for the general population by gender and age for the early detection of medical conditions in individuals of average risk with no symptoms. So if you have symptoms, like if you find a lump in your breast, you're not going to do a screening mammogram. You're going to see your physician who will examine you and expedite diagnostic testing to make sure that lump isn't cancer. You wouldn't just do the screening test or wait for a screening test for that. If you have family history of breast cancer, then depending on the age and the genetics, we may do other screening or start diagnostic tests earlier for you. If you have family history of colon cancer, you wouldn't be doing the stool, occult blood, or FIT tests as a screen. You would be doing regular colonoscopies every 5 years, starting when you're at the 10 years younger than the age of your first relative, like who had that colon cancer or polyps. For example, if your father had colon cancer diagnosed or symptomatic at age 65, or let's say 55, you would start your screening at age 45 with a general surgeon or gastroenterologist, and your family doctor can arrange that and make sure you do it every 5 years, depending on what they find. So that's different from the frequency and the type of these screening tests. So, so if you have family history of these conditions, talk to your doctor about what screening you should be doing. Screening for high blood pressure. So it's generally, we used to say before the pandemic, we should screen most adults over 18 at every appropriate medical visit, and usually that would be annually. But there's a large number of my patients that I actually haven't seen in person for 3 years, just because telehealth has become at least a third of my day. So we're doing phone calls and video calls as well as in person. So some patients that live further out of town might prefer to do some things by phone or video rather than coming in person. But bear in mind, some things you can't do by phone. So I always ask patients that are adult patients that we haven't checked their blood pressure and recorded in the chart to make sure that they have checked their blood pressure at some place that's reliable. So we don't know if every pharmacy has an accurate blood pressure machine. You may want to check with the pharmacist to make sure that it's calibrated regularly and is correct. A lot of people have home blood pressure machines, but if they're old or you bought it on Temu, it may not be the same quality as a good quality machine like the LifeSource machine that I found that when patients bring their LifeSource machine in and it's not too old, it's very accurate compared to our mercury and regular office sphygmomanometers. So if you haven't had your blood pressure taken and you're over 18, make sure you do check your blood pressure at least once a year would be good. So the screening of cervical cancer. So we now know that virtually all cervical cancers are caused by the human papillomavirus, HPV. So there's been a change in how we've been doing screening. So up until 2 years ago, we would do just the pap smear. So the pap smear is a sample from the inside and outside of the cervix in women starting at age 25 and continuing to age 70. And generally, the frequency with normal pap smears would be every 3 years. And if there's an abnormality, of a pap smear, then the cancer agency will advise when the next one should be 6 or 12 months or 24 months. At the age of 70, if a woman can stop doing the screening if the three successive pap smears are normal over the previous 10 years. So that has been how we've been doing it for many years. However, so this is kind of the procedure. So speculum is used. We take the sampling from the inside and outside of the cervix. It typically was placed on a slide, but the new way is actually putting it into liquid media where it's kind of computer-assisted technology at the lab where they'd be able to more accurately detect. So it no longer has to be put on a slide, but rather in a solution that's sent off through the lab to the cancer agency. So for all women that come in for their pap smears, they'll also run the HPV test. So it wouldn't actually be a separate swab. They are able to run it off the samples that we send in for the pap smear. So we're finding that all our patients are getting a HPV result as well. So the HPV is an alternate way of screening for cervical cancer. It's screening for high-risk strains for the human papillomavirus that are correlated with an increased risk for cervical cancer. So in a woman that hasn't had her PAP in the last 3 years or 36 months, they will be sent a package to their home that includes a swab, and they can self-swab and send it back in the envelope to the cancer agency. And then if that's negative for HPV and it's a good quality swab, according to the report, then it could be repeated in 5 years, either by a self-screen again or it could be done in the doctor's office. So my patients coming in for their pap smear, I let them know that there's also going to be an HPV run on it. And if both the cytology and the HPV are negative, that means no abnormalities, then you'll have the option of doing just the swab at home or a swab in the office, whatever they prefer. But often it is more comfortable for women to do it at home. And I have other patients that really want me as a doctor that they trust to take a proper swab. So it's the women's preference. We recently learned that the cancer agency for women over 55, that the cytology, looking at the cells underneath the microscope, that interpretation is no longer done, that they would just do the HPV test. So the HPV test comes back and that tells us when the next screening is doing. And if the HPV test is a positive, then cancer agency will give us recommendations if they need a pap smear, if they need a repeat HPV test in a number of months, or if they need to go for a colposcopy, which is like a pelvic exam with a microscope looking at the cervix done by specialized gynecologists at the hospital. So pap smear, in a nutshell, it has changed and it can be less invasive and more comfortable for women. Screening for diabetes. So we used to say people over 40 should be tested every year or two for diabetes, but the consensus in Canada is people at high risk based on a risk calculator. So you'd have to Google find risk or the CAN risk calculators and determine if you're a high risk. And that includes family history plus a number of other risk factors like hypertension and high cholesterol and being overweight and being inactive. So a variety of different things, and also the frequency of eating fruits and vegetables. And then people that are very high risk, according to those two calculators, they are recommended to be screened every year. So if you haven't been screened for diabetes, do talk to your doctor to see if you're due for a test. And if you have a family history of diabetes or have had diabetes in pregnancy, you are at higher risk and you should be doing your test at least every 3 years, but possibly more frequently. Now, of course, if you had the symptoms of diabetes, you should go to your doctor. We would actually do not just the non-fasting test, but also the fasting test. And then that could be followed by what we call the glucose tolerance test, where you're fasting, blood tested, drinking sugar, and then blood tested again in 2 hours. So for breast cancer, so you don't go for the screening mammogram if you feel a lump. where if you have a family history, then your doctor will tell you when you should start screening mammograms, usually at an earlier age. So this is officially for women aged 50 to 70 years of age every 2 years. But if there's a family history of breast cancer, recommendation is every year. And women may start the program at age 40. In fact, for most of my patients, I recommend starting at age 40. There's still an ongoing debate of when's the best time, but of course, if we start early at age 40, there's not excessive radiation that will increase any harm to the individual, and it may detect breast cancer much earlier, rather than if we waited for symptoms between age 40 and 50. And my patients that are over 70 but still have but they're very healthy and fit and very active and likely to live at least another 10 years or longer, I will write them a note to recommend that they continue screening mammograms every 2 years because they will benefit from early diagnosis. However, if an older woman is very frail, has other chronic conditions, and has a short life expectancy of just a few years, um, she should talk to her physician whether or not a screening mammogram is still appropriate for her. The screening for colon cancer used to be through what we call the fecal occult blood test, but now there's the FIT test, which is very specific for blood only coming from the colon. So if someone had a bleeding ulcer, it would not come out as a positive on the FIT test. The test is done on people with no family history of colon cancer or polyps and adults over 50 years of age, and then officially every 2 to 3 years. But the Cancer Agency in BC is set up to send reminders every 2 years. If blood is detected on the FIT test, then we expedite a follow-up with a specialist who will do a colonoscopy, which is the image down below. Of course, you'd be sleeping at that time after having done a prep that empties out your bowels with watery diarrhea for a day. The scope is done with sedation, so you won't feel every turn within your colon. And it's a safe test practiced by experienced endoscopists. So the risk can be perforation of the intestine, could be a risk for infection, but in the hands of a good specialist, like all the specialists I send my patients to, it's a safe procedure. Another screen in some provinces, some countries, they offer colonoscopies every 10 years because colonoscopy is the gold standard. But this is not a benefit of MSP in BC. So it's not offered as a screening test. So though people can pay privately in some of the private clinics to do the colonoscopy. So without any family history, without any symptoms, if your colonoscopy is clear, it can be done every 10 years. And if you've had a positive FIT, and we did the colonoscopy and it was negative, the specialist will usually tell them that they don't need to do the FIT test or any colonoscopy for another 10 years. Just remember, if you have symptoms like blood in your stool, change in your bowel habits, change in the stool caliber or the frequency, we don't rely on this. You want to see your physician, and he or she will help you decide on the best test for you. Screening for prostate cancer traditionally was just with the digital rectal exam. And sorry to disappoint the guys out there, it's not a high-tech test. It's actually real hands-on, glove on the finger examination, the digit referring to our finger. So generally men over 50 or men over 50 should consider doing the digital rectal exam every year. It can tell us how the prostate is growing, and we might be able to detect a small growth of a prostate cancer. A more sensitive test for prostate cancer is the PSA. So that's a protein produced by the prostate that we get tested with a blood test. It's not recommended that every man over 50 do this as a routine test, because if a man is 80 years old, they might have a high PSA from gradual enlargement or benign enlargement of the prostate, or it could be from a small tumor that is not going to kill them because they don't have a long life expectancy. So it should really be discussed with your family doctor who knows your health and talking about the risks and benefits of identifying any cancers with the PSA blood test. It also is not covered by MSP if a person does not have prostate cancer. So if we don't believe the patient has prostate cancer or strongly suspect prostate cancer, we have to indicate that it's a private pay, and the patient, including myself a couple of months ago, has to pay $45 to, for example, to Life Labs to get that test done. But for most of us, it's worth it if we can afford it for early detection. Well, and just a general recommendation, if your doctor checks your prostate with a digital rectal exam, don't ask for a second opinion right away because they'll just use two fingers. So just a reminder, screening tests are for individuals with average risks and no family history and no symptoms. But if you do have symptoms for those conditions or family history for them, you may require specific earlier, more frequent testing. So do share that information and those questions with your family doctor. And a reminder, what is health? It's not the absence of disease. It's not the treatment or cure of disease. I define health, and this is my personal approach, as the optimal balance of the important areas of your life based on what you value and where you find meaning. I believe that health is the achievement of your positive potential, and I believe we each have a positive potential, and we also have a duty of giving it to the world, our gift to the world, but also bringing it out in everyone we come in contact with. And that's why I like to share this as my calling to help you achieve your positive potential. And I invite you to share any information that you get from this or from our website and from the handouts with the people that you love that you'll be seeing over the holiday season. And reminding you that we're all here together and we're all responsible for a healthy community. And that's just a quick advertising for our next presentation, which will be on medical ethics, where you'll learn everything you need to know about your medical history and who gets to look at your records and how to, the key things you should know about every medical treatment and how to look after your own rights and the rights of your loved ones in the healthcare system, including the hospital or your doctor's office. So I'm going to turn things over to Leona because it's right at 8:30 to see if there's any questions I could answer for our audience, our very patient audience.
That's great. Thank you so much, Dr. Wong. Yeah, we're just on time. That was a lot of information that you shared there. So thank you so much. So we did have a question. Is there any good rule or set of things to look for to determine between calling 911 and going to the hospital or to the doctor's office?
If it could wait, if it could wait hours and hours at the end of the day to see the doctor. So if you think you might have a chest infection like a pneumonia, um, your doctor can assess that. But if you're so short of breath that you can't even walk across the kitchen or can't get up the stairs or out the door, then that would be 911 because you wouldn't be able to drive to the hospital yourself. If you're having something like a stroke or potential heart attack, or your loved one has symptoms of chest pain or loss of function, like a potential stroke or facial drooping, that may indicate a blood clot that's blocking the blood flow to a part of the brain or to a portion of the heart. And the longer there's the obstruction, it could be the dying of brain tissue with permanent disability or the death of heart muscle, which would be permanent too. So every second counts, and it's much faster to call 911 in most places than to go to the hospital unless you're right across the street from the hospital. I know there's sometimes issues we hear about 9/11 in different areas coming in, but we're pretty blessed in Burnaby with pretty rapid response. Firefighters usually arrive really, really fast because they're so close, and then the ambulance. So we're very lucky and usually in the lower mainland. But a heart attack or stroke, then that's emergency by 911, not driving yourself and not waiting for symptoms to get better overnight. Um, If you have severe abdominal pain, I didn't mention so much like appendicitis, right? Lower abdomen, below the belly button, like severe abdominal pain with fever that's getting worse, it hurts to move, it hurts to ride the car, then that requires emergency. And if you could safely have someone take you to the hospital, that's appropriate. And of course, if you had vertigo, I don't think you should be driving anywhere.
Please don't.
Yeah. If it's vertigo that could have other neurological symptoms like a stroke, then 911, get assessed at the hospital as soon as possible. So I hope that helps. There's so many things in between that really take a little bit of judgment. So sometimes if it's something in between, you can call the family doctor's office and they could tell you you should go to emergency. Sometimes it might seem obvious to us, but we deal with it every day. So we're there for you. But hopefully your doctor's office doesn't ring and ring and ring, and then you're getting sicker and sicker. And things like the worst headache you ever had, don't wait till you get an appointment with the doctor's office because that could be a week or so. But that's when you would really want to go to the emergency if it's the worst headache you ever had, because that could be a bleed in the brain called a subarachnoid hemorrhage.
Mm. Thank you so much. This next one's for me. Will we share the presentation as a reference for any follow-ups with your doctor medical test? So we will. So I will be updating our website tomorrow. You will actually receive a confirmation email for participating in tonight's talk, and I always include a link to our website. So keep an eye open for an email from Zoom, and so there'll be a link through. So hopefully by the time you get that link, I'll have updated the recording of tonight and also the relevant materials for from Dr. Wong. So yeah, and be sure to before we wrap things up, just be sure there's the evaluation that's going to pop up when I close down the webinar. Please take the time to complete that. We'd really love your feedback. And if you're not already on our mailing list and you want to hear about you want a little invitation from me to participate in our upcoming talks, then be sure to fill out that field in the survey. And I think that's it. So from me, except happy holidays and Merry Christmas to everybody that logged in. Masood, thank you for logging in again. Always great to see you. And to you, Dr. Wong, thank you for everything you do.
Well, Merry Christmas and thank you too, Leona. And Merry Christmas and happy holidays and a healthy new year to all of you. And thanks for joining us tonight when you could have been
That's,
watching a Hallmark movie or shopping.
that's right. Well, that's on the agenda now. Awesome. Thank you guys so much. Have a
Okay,
great
good
night.
night.
Good night.